Hello, everyone. This is Sam. Thank you so much for sending me this question. Thank you, especially Sanya, for sending this question over to me. This question, I have seen this question before. I have seen that people keep worrying a lot about this one. This has been a source of confusion for a lot of people. Uh, First of all, I'd like to tell all of you, please remember, don't worry too much about some extremely confusing questions, because what happens is that many of these questions have very poor recall elements. Okay, you have to remember that there are people who contribute to the questions bank when they were confused. Okay, so they couldn't understand quite a straightforward thing in the exam, and they the way they viewed that the examiner was posing question, they remembered it only in that way. They started worrying, and they tried to do a good thing by, they tried to alert people that this could be a question and this could be worrying. But then uh, if it sounds too difficult, then I would still say, please don't worry, just be very straightforward, be very good with your crisp, with your guidelines. Just be sure what are you going to whatever you are going to say is based on some guidelines. Okay, for instance, if there's a structured discussion, you're answering most of the questions, and there's one small thing where you get stuck, you have to reassure yourself that you're not going to lose a lot of marks just because there was one thing that was not very clear. Even if the examiner doesn't look very satisfied, if you have answered most of the questions, please don't worry too much. That's my first request. Then coming to this one, for instance, I think I might have seen this, but I never bothered about this even for my exam. I just don't worry about these things. As long as I feel that I am good with my guidelines and I'll be able to answer the questions there, I don't really worry. Okay, I think that's a good recipe to feel relaxed in the exam. The more you're relaxed, the more you're likely to succeed in this exam. I can assure you that this exam is so easily doable that just be good with your communication, be good with your guidelines. Okay, so let's jump to this question now. It says this was a structured discussion of 22 in transfusion syndrome. She was at 27 plus 6 weeks, at 27 plus 6 weeks gestation, on the basis of scan report. Okay, they say that the consultant asked, what will you do on that evening? Was probed a lot with this question, what will you do on that evening? Now they're saying that there was another version where she was 27 plus 1 week, basically, with an AFI of 22 for twin 1 and of 2 for less than 2 for twin 2. Okay, first twins Dopplers were normal, and the second Doppler absent means basically what they're trying to say here is that end-diastolic flow was absent on the Dopplers, not that the Dopplers were absent. Okay, then they said that the examiner asked, I'll ask you 3 questions only, so reply carefully. And now these are the questions. So we'll deal with these questions in a minute. Okay, what do you think you should be what are the guidelines that you should be bringing into this question? Okay, just ask yourself, what are the guidelines? What will be your what's the primary focus here? So very clear, isn't it? That is twin guidelines. Okay, you'll remember twins in NICE guidelines. You'll remember monochorionic twins from green top guidelines. You'll also bring in some knowledge from your SGA Dopplers guidance. Okay, so SGA green top guideline, where they talk about the Dopplers and the monitoring and all that. Okay, you will also try to remember what's the advice about this giving steroids for fetal lung maturity. You will remember the SIP that talks about magnesium sulfate. for fetal neuroprotection. Okay, you'll also need to remember, see, you have to, this is a multifaceted question because everything will be incorporated in this. You'll have to remember the GBS guidance as well. Okay, so when do you give GBS prophylaxis? Okay, remembering everything that comes with this package, it will be, you will make a whole package of management for this lady, and you'll need to know, need to have a good knowledge of in utero transfer. Okay, if your center is not the regional center or the supra-regional center for the management of TTTS. Okay, so you'll need to incorporate all that. Okay, and of course, quintro classification of this one. So let's see quintro classification of this one. What do you think is the quintro classification here? We need to know that when there is only a difference between the AFIs and no other problem, everything else is normal, then that would be quintro stage 1. When the bladder of 1 disappears, that will be quintro 2. Then when the Dopplers become abnormal, that will be quintro 3. Okay, when pericardial or pleural effusion or ascites, it will be quintro 4, and quintro 5 will mean that one of the twin is dead. Okay, one or both of the twins are dead. Okay, so as I said before, these are the topics that you need to remember: twin pregnancy, nice guidance, and all these. I've written them, listed them here for you guys. Now let's quickly jump to what are your, so they are saying that what will you do on that evening? So you remember the immediate management questions that will be coming to you, okay? And then other relevant questions. So your first question, you will say that I will want to know whether this, is a patient who is previously diagnosed as TTTS, and did she have any treatment, or is she undiagnosed and she's now presenting with this? Why am I'm saying this? That we need to find out whether she had any laser ablation or at all or not, and or any amnio reduction or septotomy or anything. Okay, and also that if it was done, then whose care is she under? Because that's important as well, that rather than jumping to to management and all that, you as an ST5 in a unit where you see something, a case being presented, to you like this, if you're not thinking that is she under care of some fetal medicine team, okay, is she under care already? Do they already know her? So if you are not thinking in that direction, then you are missing the main, most important aspect of a management. You start planning management, I'll do this, I'll do this, I'll do this, and you don't focus on that. Oh, she's already under care of that consultant or that department. Let me inform them, let me ask them for their advice. That's very important thing, crucial thing. If you miss that, that will not shine very good on your performance, because it will show your absence of mind, really, that you're not really thinking. You're just focusing on the question, not on the situation. Okay, you're just thinking that this is just an exam. You're not thinking that this is a patient that they're talking to you about. Okay, so if she's a patient who's coming, just relax, deep breathe, ask yourself, isn't it normal that you'll ask yourself, is she already under care of somebody? So say the same thing to the examiner as well, that I want to find out whether she's already a known case of TTS, and is she already under some team or not? Okay, of course, then have a look at her Dopplers and CTG. If not done, if done, then if not done, then do them. If done, then have a look at them, and you'll need to see whether there's any need of urgent intervention. And we need just prepare your mind that you'll need some urgent advice from specialist center, whether it's a regional center or a supra-regional center. This word supra-regional center is mentioned in your NICE guidance. Okay, so usually tertiary center, or sometimes even even something superior to that. Okay, so not even the supra-regional centers, not all the tertiary centers would have supra-regional centers. Okay, so supra-regional centers are too high-tech, and some of the regional centers will be supra-regional centers. Okay, so remember these things, or parallel to all of these things, remember, you don't forget that in your mind, these things should be running in your mind, that I am, it's not only about twin 1 and twin 2 and the health of twin 2 deteriorating because of twin 1 or vice versa. It's also that if for both or for one of them at least, we'll need to consider all of these things like steroids and GBS prophylaxis and magnesium sulfate. So what happens is sometimes we think of TTTS, we become tunnel visioned, and we only talk about in utero transfer, or maybe only management of if transfer is not required and we are at the center, then maybe we become tunnel vision and start talking only about amnio reduction and subtotomy and things like that. So don't be tunnel visioned. Okay, that's an important thing. And I'm sure if you play alert and safe at the same time, you will score so much high that they will stop probing about any tiny stupid kind of things that can confuse you or make you nervous or anything. You need to show that you have a hold of the subject. You can, it's in your grasp fully. Okay, so now let's jump to one of the questions here. Also, yeah, there's no harm in asking the consultant that, are we a specialist, I'll see if we are a specialist regional center, then fine, we'll talk to our own fetal medicine unit. Okay, and if it's not us, if it's in some other hospital, then depending on that, I will proceed. Okay, so that will mean that somebody will need to talk to them. Now you will come to say that what are the main things that you will be, what are they are saying, what will you do on that evening. Yeah, so you will say that she is at Quinto stage 3. Okay, there is this is quite a serious situation, and I'm worried about the outcome of the twins, and that's why I'll make an urgent referral. I mean, even in this evening, I'll need to make an urgent referral to the specialist center. I'll need to arrange 2 cots in the NICU. Now, remember one thing, please, that whilst you are referring to the specialist center, if you are not the center, and if you are the center, then you are speaking to your fetal medicine unit. But please also remember that parallel to that, you are still talking to the NICU of your hospital. Even if she's to be referred, you'd never know she can deliver. She may need an emergency delivery. So talking to NICU for 2 cots, that will be crucial, and you're not going to forget that. Okay, so again, the alertness of your mind, the presence of your mind will help you there. Okay, now you will say that I'll need to make urgent referral to the specialist center. I'll need to make arrangements for 2 cots in the NICU. If in utero transfer is required, then you'll talk about that. Say that I'll consider targeted steroids after discussion with my consultant, and whether we can help her or it's not really going to be us, but whether the fetal medicine unit is considering to do a septotomy or amnio reduction. So sometimes what can happen that you are in a center where the fetal medicine consultant is not available at that time in the evening, and but still something needs to be done for the second twin or the first twin, whoever is the smaller one. So what are they saying? Yeah, so first twin is 22 AFI and the second is less than 2. Okay, so it means that the second twin is basically, having will be the one who will be at a risk of, suffering from oligohydramnios here, and because this twin would have a disappeared bladder as well. If somebody is able to either do a septotomy at that point, because this is too late gestation for a laser ablation. So either somebody is able to do a septotomy, or because septotomy is much more specialized procedure, amnioreduction is a much more simpler procedure. Okay, if somebody is able to do amnioreduction in twin 1, that might relieve some pressure from twin 2 circulation. Okay, so that could be an option as well. So you will consider that if fetal medicine unit is available to do something, they'll be able to do septotomy. Okay, it will be not your responsibility, then you will be handing over care to them. But if the consultant is asking you, especially questions that what can I do in this evening, so I'm only thinking on these aspects, that if they ask you what are you going do on that evening, you are thinking what is it that they are asking. So apart from the whatever monitoring is required, you'll think that, will I just let her go into control stage 4 if she's already on 3, or is there anything that I can do? So what comes to mind is that you can relieve some pressure on twin 2 by doing a amnioreduction in twin 1. So and it's not for you to decide. So remember, what you are saying is that you will say to the consultant that I will want you to speak to the fetal medicine consultant here or some other supraregional center. There must be some help and advice available somewhere. And even if the patient is not to be transferred or is not possible to transfer, maybe they advise you some amnioreduction. If they advise that, then you can help me with the amnioreduction before you go, please. Okay, so this is something, if she needs amnioreduction for the survival of the other twin, then doesn't have to wait for the next morning. Amnioreduction is a pretty straightforward procedure for a consultant level. Okay, even some senior like ST6-7, they would be able to do. You'll say that, yes, I will need your help with that. Okay, now this is where we have dealt with this part of the question. Okay, well, what will you do on that evening? Also remember that you'll mention CTG, ductus venosus Dopplers, and the daily umbilical artery Dopplers. You will mention steroids. Okay, so with the advice of the fetal medicine unit and your consultant, you will decide whether she needs whatever she needs. Does she need targeted steroids now? Does she need any other, like will she be going for emergency delivery? What does the CTG say? Is it too critical situation at the moment and she needs to be delivered? If yes, then what do they say about any magnesium sulfate or anything else? Okay, so you will take those measures as well. Now we have dealt with this first part of the station. This is how you can answer, and there should not be any big trouble there. Okay, now let's go to the next part. They're saying that they're kind of dividing the question there. Okay, he says that I'll ask you 3 questions, so reply carefully. So okay, so it does make one nervous that what's he going to do. He's saying that you are my registrar and it's 6 p.m. I'm about to leave. Tell me, is there any important patient? Okay, so this is what I've added here, that yes, please, you describe this patient in this bar format, please. Okay, so you describe the patient, you say this is something that I have made for you. Okay, let's go through this. So yes, so you'll say that yes, I need to discuss an urgent case of a patient with TTTS. This is situation. In situation, you don't have to go into stories. Okay, you just have to straight away tell the situation, like like if it was shoulder dystocia. Yes, I want to discuss it. Inform you about a patient with shoulder dystocia. Quickly, just say it in minimum words. And similarly, whatever is happening, just say straight away and quickly. Okay, just yes, I need to discuss an urgent case of patient with twin-to-twin transfusion syndrome. This is situation and background. She is a gravida, whatever gravida she is at these many weeks of monochorionic twin gestation. Who was she diagnosed case or was she undiagnosed, depending on whatever they've told you, just mention who was diagnosed TTTS as these many weeks, or who was previously uncomplicated, but now her Dopplers and the scans are indicating problem. Okay. Assessment, she seems to have Quintro stage 3 TTTS, and or whatever stage they've given to you. From here it seems stage 3. If they've given you a different situation, you can say that this is the situation. Okay. And then you can say that whatever else they have mentioned about the twins, if they have said that the bladder one is disappeared, you can mention that in addition. Okay, whatever can come in the assessment then. Okay, including DVP and EDF, whether present or absent and all that. Okay. Then, so you've done the SBA and then recommendation. Recommendation, you have to be straight, to the point, straight, upfront, no problem, no worry that how am I telling this to the consultant. Say, I think we need to discuss her urgently with the specialist center. Okay, specialist center, either regional or supra-regional center, with a view to immediate transfer of care or advice for urgent management. Okay, awaiting transfer. And if we are the center, I've again written it here so that, just to help you focus, that if we are the center, then you'll say that I will like you to speak to the FMU consultant directly to, to urgently to get some advice. You can speak as well, but if he's saying what you want me to do, you can say that I can, I need your advice here. I need your advice that shall I call the, consultant and, get his advice, or would you want to do that? If we do that, it's not unnatural to say that, whether you want to do it or you want me to do it. It's absolutely fine. It happens in our daily, sometimes they think that it's okay. We can perfectly, our registrar can explain the patient to the consultant, but sometimes as a matter of courtesy, if the consultant calls a consultant, which happens actually most of the times, when the consultant calls a consultant, then they understand the urgency more. Okay. And there's more, courtesy as well, of course, because they understand that if a senior most person in a unit has been involved, which is a consultant, then there must be something really serious. So they feel that they feel the intensity or the seriousness of the situation, and they respond, they come for help sooner. Also, please remember that if we are the super-regional center, and FMU is not really another department, it comes under obstetrics, it's obstetrics and gynecology team. So it's our team, but these people, these consultants are probably not on call. Okay, the fetal medicine, if labor ward on call or the gynae on call is somebody else, and they are the labor ward on call person is wanting to speak to the FMU, then maybe these consultants are at home or wherever, and so consultant to consultant talk will be a bit more helpful in that case. Okay. But it's again, it's not necessary that that they have to talk. So be open-minded when you're talking in the exam. You should know that even you can make that call. Okay. Then you'll say that we need to ensure that 2 cots in NICU are available. We need to ensure the availability of 2 cots in NICU in anticipation of preterm delivery. Now, this anticipation of preterm delivery can mean that we have to deliver an emergency, or therapeutically we decide that the babies cannot continue for longer, so we deliver. Of course, when I say we, I mean this as a super-regional center, if the relevant consultants, they think that. Okay, so you'll say that, and you'll say that you'll remember that they may advise to do urgent amnio reduction, and you are saying this to the consultant that if the FMU consultants advise urgent amnio reduction, I'll need your help with that. Okay, because of course I'm only ST5, I'll need your help with an urgent amnio reduction. He's asking, what, as it's 6 p.m. I'm about to leave, so you are wanting to make sure that your patient is safe, your mother and babies are safe before the consultant leaves. Okay, that's why you are saying that. Then okay, also mention that I'll ensure that we do CTG, arrange Dopplers, give her targeted steroids along with rest of the management advised by the team. Then you and okay, don't forget this part, that patient debriefing and patient informing the patient of what's going on is very important. Okay, so let me highlight this one as well, that you or I, it's not a, I don't like it. Okay, so you and I will need to explain this. Okay, you or I will need to explain the situation to the parents and ensure that they are on board and they are partners in their care. This is important. Okay, that we need to explain it to the patient and make her and her make both of them, both the parents, partners in their care. Okay, then you'll say that, okay, now the question was, next question here says that well, what should we do? And the question number 3 here says, if they remain fine until evening, what should we do? Now, in our SPAR format, we are covering already what should we do. Okay, so if you would have told them already, the consultant is not going to, the examiner is not going to ask you again if you've already mentioned the SPAR format. Okay, but if the question is that if they remain fine until evening, then what should we do? So we actually are answering that if they remain fine, we are answering on the basis of that if they remain fine until evening, what should we do? So we'll take advice, we'll give whatever is required, we'll do all the monitoring and CTGs and ductus venosus Dopplers and all that. Okay, this is if they remain fine, but if they don't remain fine, then of course you may end up doing an emergency cesarean section, which will have to be done with the consultant. Okay, mostly will be done by the consultant, or he should, if they probe you that maybe you can do, maybe you are signed off, only if they say that, then you can say that because this is such a preterm and it's twins, I will still like your presence on the floor when I do it. Okay, so if only if they say that you are signed off, then what will you, why do you want me to do, or what will you do, or you still want me to do? You can say that I can do either under your supervision because I'm concerned about the, she's preterm, she's twin pregnancy, and I can either do under your supervision, or I'll at least require your presence on the floor in case there is some complication. Okay, so this is how I feel is the best way to attack this station. I hope I've made this clear. So please, also please try to go through the in utero transfer details. I've not mentioned them here because I think these are the most important aspects. You will say that if in utero transfer is required, we'll do that, but the details are not discussed here because you already know the details of that. And if they ask you, then you should be able to say the details of in utero transfer. If you have any queries around in utero transfer, you just give me a shout and I'll try to cover that in a separate video for you. Okay, so I hope this is helpful. Do let me know okay, how it feels. Is it making the things uneasy for you? Okay, and good luck for your exam. Any more questions, please drop them in the Telegram group and I should try to help you with those. Okay. Okay, girls and guys, bye-bye. Take care.